Okay, so have you ever, stumbled across a statistic that just makes you stop and think, whoa, what's going on here?
Oh, all the time, especially in this field. There's always something new popping up.
Right. Well, this one really got to me. Self-reported cannabis use among pregnant women. It more than tripled in the U.S. between 2002 and 2020.
Yeah, I saw that study too. Pretty wild increase, right? From 1.5% to 5.4%.
Exactly. I mean, that's not just some small fluctuation. That's like a huge shift in behavior. And it makes you wonder what's driving that change. It's a pretty big deal, especially when you think about the potential impact on both the mothers and their babies.
Totally. And that's why this new research, this one published in the American Journal of Preventive Medicine, is so interesting. It takes a closer look at the prevalence of diagnosed cannabis use disorder, so CUD, during pregnancy.
And that's what we're going to really dive into today.
Exactly. We're going to try to unpack the scope of this whole issue based on what this research found and talk about why researchers are so concerned.
Okay, so let's start with that initial statistic. That tripling of cannabis use among pregnant women over less than 20 years. It's a pretty dramatic change in a relatively short period. Any thoughts on what might have contributed to that?
Well, the study itself doesn't really dig into the reasons behind that initial rise, but it is interesting to think about it alongside the growing trend of legalization and the changes in public perception of cannabis use.
So do you think that maybe more people are comfortable using cannabis because it's becoming more accepted, even during pregnancy?
It's possible. This period definitely saw a lot of changes in how people viewed cannabis, and that could have played a role. It raises some important questions about education and awareness, especially when it comes to the potential risks involved.
Definitely. Because even though cannabis use might be becoming more common, the medical guidelines are pretty clear. They advise against it during pregnancy, right?
Absolutely.
Yeah.
And that's not just being overly cautious. It's because there are real medical concerns.
Right. So what are some of the risks? Like, what are the potential negative outcomes that are associated with cannabis use during pregnancy?
The main concerns revolve around the potential risks to both the mom and the developing baby. Like, there's a link between cannabis use and lower birth weight and preterm birth. And there's also a lot of ongoing research looking at the potential long-term effects on the child's development, particularly brain development and mental health. And that's why it's so important to understand not just general cannabis use, but how many people are actually experiencing cannabis use disorder, that clinically significant impairment.
So this new study zeroes in on CUD. Why is that distinction so important, and how did the researchers approach investigating it in this specific group of pregnant women?
Well, because CUD isn't just casual use, it means that someone's using cannabis in a way that's causing problems in their life, real problems, and that's clinically significant. To figure out how common this is, the researchers used this massive database. It's called the Meritive Market Scan Commercial Claims and Encounters Database. It's huge. And they specifically looked at pregnant individuals between the ages of 12 and 55 who had continuous commercial health insurance. So we're talking about a lot of data, and this was all between 2015 and 2020.
Okay, so that seems like a pretty solid way to get a good sense of how widespread CUD is during pregnancy. Big data set, several years of data. What did they find?
So they used ICD codes to identify diagnosed cases of CUD.
Remind me again what ICD codes are.
Oh, right, sorry. It stands for International Classification of Diseases. They're the standard diagnostic codes that healthcare providers use all over the world. So the researchers were looking for those specific codes in the database to find women who had been diagnosed with CUD.
Makes sense. So what did they find? How common was a CUD diagnosis in this large group of pregnant women?
Well, out of almost 900,000 pregnant women, and keep in mind this represents over 1 million pregnancies, the total, what we call the cumulative prevalence of a CUD diagnosis was 0.26%. Now, that might sound small at first, but when you think about the sheer volume of pregnancies we're talking about, it represents a significant number of individuals. And breaking it down by year, it ranged from 0.22% back in 2015 up to 0.27% in both 2018 and 2019. So a small upward trend there.
Yeah, like you said, even a small percentage can translate to a lot of people when you're talking about that many pregnancies. And this study is really valuable because of its large sample size, right?
Exactly. Dr. Priscilla Gonsalves, she led the study, and she pointed out that a lot of past research on this focused on smaller, more geographically specific groups. But they wanted to look at this on a larger scale to really understand the prevalence of CUD in a broader population of women across the country.
Okay, so that makes sense. Now, their study period ended in 2020, a time when we saw a big push towards legalizing medical cannabis. I think by then it was legal in a good chunk of the country, right?
Yeah, that's right. By 2020, medical cannabis was legal in 34 states and Washington, D.C., so pretty widespread.
So I'm wondering, how do you think that increasing availability of medical cannabis played into what the researchers observed?
That's a great question. The researchers themselves brought up the possibility that some pregnant women might be using cannabis to manage some of those difficult pregnancy symptoms, things like nausea, for example.
Which, I mean, makes sense, right? If it's legal and you're feeling awful.
Exactly. But here's the thing. They also pointed out that in some cases, even if someone starts using cannabis with the best of intentions, it could very well develop into CUD. So it becomes tricky to draw that line between what might start as self-treatment and what actually becomes a real problem.
That's a really good point. So you might have someone who thinks they're just managing symptoms and they may not even realize their use has become problematic. And I imagine that can make it even harder to identify CUD and get people the help they need.
Absolutely. And Dr. Gonçalves also highlighted another big obstacle, that some women might be afraid to tell their doctor about using cannabis because of potential legal consequences.
So they just don't mention it, even if they're struggling.
Exactly. And that's a huge problem because it means the numbers we're looking at, the prevalence of diagnosed CUD, might be even higher than what the study found. And of course, it prevents women from getting the support and care they need. It's a tough situation.
So it's not just the individual's perception of their own use, it's also potential barriers in the healthcare system itself.
Right, and Dr. Gonçalves suggested that even though healthcare providers are in a prime position to discuss cannabis use and the possibility of CUD with their patients, they might not have the resources or the right kind of training to effectively intervene. It's a multi-layered problem.
Wow, okay. That makes a lot of sense.
Yeah.
It sounds like the researchers are calling for a much more comprehensive approach to addressing this issue.
They are. Dr. Sylvia Martins, the senior author of the study, stressed the need for, a much deeper understanding of what leads to CUD in pregnant women. And that means looking closer at how we diagnose it, considering things like the severity of the disorder, and really understanding the factors that might prevent someone from getting diagnosed or seeking treatment. We need more research to figure out how to actually prevent these cases and what the best ways to intervene are.
That's so crucial. And it's worth noting that this study was funded by the National Institute on Drug Abuse, which is part of the NIH, so the National Institutes of Health. It's a pretty big deal to get that level of support.
Absolutely. That NIH funding highlights just how important this whole issue is from a public health perspective.
Totally. So we've covered a lot of ground today. As we wrap up our deep dive, what would you say are the most important things we should take away from this study in our discussion?
I think there are a few key takeaways here. First off, we've seen a pretty dramatic increase in cannabis use during pregnancy in the United States. That's not something to take lightly. Second, even though the study found that diagnosed CUD in pregnant women, at least in this group with commercial insurance, was relatively low, around 0.26% overall, there are some red flags. It looks like it's increasing, and there's reason to believe that a lot of cases are going undiagnosed.
Because of that fear of legal repercussions and maybe not having the right support from their healthcare provider.
Right, and when you factor those things in, it becomes a much bigger concern. And finally, we really need more research to fully understand this issue, to improve how we diagnose CUD, and to figure out how to best support women who are struggling with it.
It's a really complex issue. And it raises some big questions. As cannabis becomes more accessible and we see more people potentially using it for self-medication during pregnancy, what does that mean for healthcare providers? What are the ethical considerations? And what does it mean for public health initiatives? How do we ensure that we're doing everything we can to support pregnant women and protect the well-being of their children?
Yeah, those are huge questions. We're talking about the health of both the mom and the baby and the long-term impact on families and communities. This study gives us a glimpse into the situation, but it's clear we have a lot more work to do. This is an evolving landscape, and it requires careful consideration and ongoing research.
Well said. Thanks for breaking all of that down for us today. It's definitely given us a lot to think about.
Absolutely. Always happy to be here.